Hi, this is Geronda McCray. Welcome to my trauma-informed care presentation. The reason that I am coming online first is because I want to make sure that those that are viewing this understand what myself and my attendees do. We are a part of what's called an assertive community treatment team. We work in behavioral health, and our consumer or our client are individuals that have co-occurring or persistent severe mental illnesses. And that's important because quite a bit of what we talk about, all of what we talk about, is trauma, and how that trauma affects behavior, and how that behavior needs to be responded to by trauma-informed care. So hopefully that kind of gave you a little bit of a glimpse. So when we're talking and we're using different phraseology, that you really understand that you have a clinical coordinator, you have a nurse, you have a case manager, you have a clinical health technician. All of those individuals are attendees, and we are talking about individuals, our consumers that are mentally ill. Our treatment involves medication management, financial support and help. Sometimes it's transporting. Quite often it's adult daily living, but they can be pretty tough. And right now with COVID is really difficult because they're always in the community and we're always with them and trying to help them. So I wanted to make sure that you understood who the individuals are, what we do. It is prevalent to this presentation and the activities that we do from there on. Thank you.
Awesome. I want to get started because I promised you guys that this wouldn't take very long. Can everyone can you see the PowerPoint?
Yep. The man with the writing on his face?
Hey, Mike. Yep,
hey.
With the writing on his face.
Hi, Mike.
Can everybody hear me okay?
Now we have to see Mike after hours too? Oh, man.
Whatever.
Everybody see? Can everybody see the PowerPoint? And can you hear me?
Yeah.
We're supposed to see everybody?
Awesome. All right, so first of all, I wanted to thank everyone for being a part of my presentation. It's a semester. For all of you that may or may not know, I am in my PhD program, and my program is Community Care and Counseling Traumatology. And so I've picked a subject that is surrounded around trauma. And I wanted you all to be a part of it because I feel like it's relevant to us. And this is really a discussion. It really isn't just you listening to me. I want to make sure that you guys feel comfortable at any point interjecting, giving a comment, sharing your thoughts. It's something that affects all of us, but
I'm sorry, I can hardly hear. Somebody's chopping and closing doors. Is it possible we can mute until you're done talking?
Okay. So can everybody mute? Hold on, I think I can mute.
Oh, there's Mike's dog. Hi, Mike's dog.
Okay. All right, so everybody's muted? Okay, beautiful. So the idea here is to discuss a topic, which is trauma-informed care. Did everyone get their care packages on their desk?
Yeah.
Okay, awesome. All right, so what I want to talk about is, or what we're going to talk about is trauma-informed care, which is a subject that the Wisconsin Department of Health, as well as Substance Abuse and Mental Health Services Administration, has really started to focus in on. People call it trauma-informed response, trauma-informed care, but at the end of the day, it's a best practice, and this best practice is supposed to be utilized in our assertive community treatment. The idea is this, that there are two things that happen with trauma and how we service our clients and our consumers. One is understanding that trauma exists, and what that trauma is and what it means. And the second piece is understanding that our clients and our consumers experience trauma. They have trauma and they live through trauma. And so being a trauma-informed care worker integrates the idea of the informed information about trauma, and it takes it into how we service. So the very first thing I want to do before we get started is to actually show you a video.
How can you ask someone about their body? How can you ask somebody about their mind and not recognize their experiences in the world as they're living in that body, as they're thinking and having that mind? It really is about recognizing people as whole beings and not just body parts. To me, that's trauma-informed care.
The majority of illnesses and conditions that people are treating in primary care settings are trauma-related.
There are things going on inside that you cannot visibly see, that if you don't ask about, it's maybe a barrier to the actual care that the healthcare system wants to provide.
We want to give people good care, but we want them to thrive. Not just be healthy, but thrive. And it's very hard to thrive in this community.
I experienced patients that were behaving in ways that were really stressful, cursing, yelling, really heightened emotions at the front desk, in my office, breakdowns. We might naturally ask ourselves, what is wrong with that person? Trauma-informed care is really about saying, what happened? Why would a person behave that way? I think one of the biggest frustrations that I've seen from my medical colleagues is frustration. Like, oh my gosh, I keep telling this patient the same thing over and over again. How many times are they gonna come in, not listen to what I recommend, and then have the same symptoms and then keep coming back for the same symptoms? If we ignore trauma in our practices, what we're gonna end up doing is doing the same work over and over again without having a different outcome.
I mean, our experience as providers has changed from being overwhelmed, from having a chaotic clinic, to an experience where we're feeling like we are doing the absolutely best job possible.
People come willingly. They're using more services, so they're understanding that their health is not just that medical service, but it's what they eat, how much you move, and the state of your soul.
But what we've seen is people kind of having longer periods of stability, and maybe they slip, but they get back in touch with us more quickly than they used to.
Once you start communicating where you're not being dictated to, you know, someone is actually asking you, how do you feel about this? And how, you know, it builds that trust. You know, it's like, wow, they actually heard me, you know, and I see it.
Talking about and becoming trauma-informed does not have to be a traumatic experience.
This change process is incremental, and you can begin this as an individual person in your clinic and make a meaningful difference, not only to your patients, but to you as a practitioner. It's not radical to think that our job as primary care providers and why we went into primary care in all of our different disciplines is to actually help patients heal. I mean, that's not radical at all. It's self-evident, but it's like taught out of us. And what we're doing now in this movement towards trauma-informed primary care is to teach that back in, is to help people realize that their vision for why they went into this to begin with is to help people heal and to connect with them in that process, and to heal themselves in that process, and to have joy in that process.
Now, who's already been exposed to trauma-informed care or know about it?
I have, I guess.
Okay. Can you share what you know about it, Mike?
Just, I don't even remember. It's been a while. I had to take some classes by Madison. Just effective ways, I guess, to talk with people about their trauma. Like, good, I don't know. It's ways to do it without like putting yourself first. It's like really helping them get to the answer without trying to present it to them or without directing them or leading them, which isn't always easy to do.
Right. Right. Anybody else?
It's a type of modality that you use when you know that a person has experienced some kind of toxic stress or traumatic event in their life. So it's a certain, it's really a model that you're taught to use when a person has experienced those things, but it's really you have to be understanding and compassionate and empathetic, and it gives you some certain principles that you are supposed to follow when dealing with someone that has had trauma, instead of being like, what's wrong with you type thing. It's more of a, tell me what's happened to you in your past. So it kind of doesn't sound antagonistic or condescending-ish. It's more of, I really want to know your story. I want to know what's happened to you, what it is that you've experienced. And so it's really...
that is great. Anybody else? Any thoughts? We actually, every single day that we go to work, we actually work the principles of trauma-informed care. And I gave you a copy of the agenda, and in the agenda it says, okay, there are 5 different objectives that I would like you to walk away from. One of the most important things for me, if we could walk away with anything, is to support the principles of trauma-informed care. You know, through here, trauma-informed care is again, it's a culture. It's a way to empathize and respect. Mike said it, Tony said it best. It's a way that we talk with, it's the way that we think about our clients. And, you know, we have great opportunity to really look at them in a particular way. Right. And the trauma-informed care ask us to revisit and rethink that information. So there are some key principles with trauma-informed care, and you tell me if you've already been exposed to these or what you think about them. The very first one is empowerment. What do you think of when the word empowerment comes up? Anybody? And again, you guys can chime in at any point.
Well, it's empowered. Oh, go ahead, Mike.
No, I would say just encouraging people to let go of some of their hang-ups or demons they've had, and just reminding them they're not abnormal, they're not different, they're not strange.
Right.
Like, everybody has things.
Okay.
I would say, and this is just my way of thinking, but basically it's because the more they focus in on the trauma or the event or whatever it is that has caused them distress, but it's taking the power away from constantly thinking about that thing and empowering them to kind of be on top of the circumstance versus it being on top of you, if that makes sense.
Yeah, it does.
So.
It does. Anybody else?
I was thinking of building them up, because so many people try to keep them stuck where they are as far as their illness and stuff like that. And I always try to encourage my clients to, you know, you don't have to be stuck there, you know, and then I also try to build like some of my female clients' self-esteem too.
Right. No, that's excellent. Are you covering your hand on purpose?
Me?
Yes.
Oh, that was I was messing with my hair.
Okay.
You can't see me?
No.
So what do I need to do?
We
can see you now.
Your hand was in the way.
You were like covering it.
But the camera is right there.
There
Well,
we
my
go.
iPad is
Now we can
big.
see. Now we can see.
Oh, okay.
All right. So the next principle of trauma-informed care is safety. You know, safety looks a couple of different ways. The idea that they're asking us to do is that we encourage them, we treat them a certain way, we do things that help them so that they don't relapse. Any thoughts there?
I was thinking like with David, you know, that like I constantly reinforce to him about the our 24-hour line, our after hours line.
Yeah.
And with a little bit back to the empowerment is always telling him, you know, that we're there for him and we're going to get him through this tough time. And, you know, just constantly reinforcing that we're there for him and he can call us at any time and we'll always be there to help him.
Right. Absolutely.
We don't see you, Ann.
Yeah.
I don't know what happened. Don't ask me.
Click video.
I did. It is clicked. Wait, here. Is it back on now?
There you are.
Oh, hi.
Okay. So the next principle is transparency. So that one's a little different because quite often we're told, don't be transparent. Don't tell them too much. And I'm wondering what you guys think that where's the boundaries? Because the key principle says, okay, in trauma-informed care, you're supposed to be transparent.
And I don't think it means like you're telling them your whole, in that sense, where you're telling them your whole life story, every single thing that you've experienced from birth to 47. You know, transparency means your responses, how you're responding, and the choice words that you use. They should be transparent. They should be, you know, not, you can tell when somebody's talking to you and it's scripted, you know. So really it's just you're being transparent in your words, like, man, I understand that, you know, or like, yeah, I feel that, you know, whatever. But just being transparent in the sense of the person feeling safe enough to tell you their story. You know, if they feel like you just like you just, come on, speed this along, they're not going to open up to you and tell you anything.
That's great.
I feel like going off of what Tony said too, it's like kind of avoiding like trigger words and just kind of knowing your client and what they've been through. I feel like that's super important too.
Absolutely.
Yeah, that's a great comment. And I think, like Tony said, you know, I think our group as a whole does a really good job of being honest and letting our clients know, you know, this is something that needs to be addressed, or we really hear you and you can talk with us. The next principle is collaboration and trustworthiness. And so the collaborative part of it really, I think it can be a struggle for us when we're talking about co-occurring or individuals with mental illness, because that incorporates, Letitia joined us, you guys.
Hey, Letitia.
Hi, Letitia.
It incorporates their cooperation. It's asking them across every single thing that we do. We have to collaborate with them, and that can be a little tough. And we have to promote trustworthiness and respect. And I think that for me, it can be sometimes a challenge, especially when we're talking about respecting you being cursed out or told off. What about you guys?
I think we could learn from doing more of that. I think sometimes in the line of work that we do as case management, we come in as the fixer-uppers. We're going to fix it. We have the answer, kind of like we're borderline POs. You're going to do it like this, this, and this. But instead, it's asking them, using that, you know, those transparency words, those empowering, what is it that you want to do about this? Oh, I want all my $1,200. my stimulus money. I want the whole thing because I'm gonna go shopping, you know, and so it's their money, right?
Right.
So coming up with a way, we know that they can't spend a whole $1,200 because next month or next week they're gonna need something and it's gonna be major, right? So it's collabing with them. Well, how about I give you 4 this week, and then maybe what would be a good time frame to give you another 4 or another 2 or another 3? It's including them on making the decision, even though in your mind you know what the outcome or the end result that you're trying to get, but it's allowing them to come in and say, well, no, I don't want 4 this week. I want 5, and then you can give me 3 and next month.
Right.
Okay, you know, so it's that kind of collaboration. But sometimes with the population of people that we work with, that can be difficult at times, especially if their views are skewed or tainted. And so it's just a matter of being creatively collaborative. And I'm gonna be quiet because I will talk a whole bunch.
I see.
No, not Tony.
I'm gonna be quiet.
Not Tony.
And it's only because it's what I use every day outside of Project Access. It's what I do in the community. It's what I do in ministry. It's what I do. Because so many people that we come into contact with have experienced trauma. I'm sure each of us could probably say, yep, I had a traumatic experience.
Yeah.
When it comes to something. So it just becomes a way of just how it just becomes a part of you once you really dive into it. So I'm gonna be quiet.
Anybody else have anything? Any thoughts?
I'm going mute.
Tony.
Now wait, now you're going mute. So
I think building a relationship with them, you know, and you get it to a point where they trust you and they communicate with you more. But it could be like a bad day, and they'll want something their way. They can't have it their way, and you stand firm with it, but you're being respectful about it. And no, and I find myself doing that a lot. You know, and it's like a battle. It's a boundary issue where I done made it this far with this patient, this client, and now they're asking for something that I cannot give them. And it's like, I don't want to go back to the bottom. And I didn't work so far to get to a certain level with them. But you still have to stand firm with them. You have to make judgment calls that are common sense for them.
Okay.
Right.
Even though if you have to start all over with them again.
I agree.
And I feel like too with the trustworthiness, you know, you can't say, oh yeah, I'm going to look into that for you and then not do it. And then they ask you again and you say, yeah, I'm going to do it. And then you never do it. But then when you need to advise them on something like this money thing, why would they want to trust that you're going to make the right decision? Sorry, dog barking, got him mute.
All right. So we've got the 5 principles or the 6 principles here, which is trustworthiness, safety, transparency, collaboration, empowerment, and cultural sensitivity. Do you guys believe that we can support that? We can stand behind those principles?
Maybe not in that order, but yeah.
In that order that order will be cyclical in this
right.
In this position that we're in, it will be cyclical. It will happen at different points in time, but it will be continuous. It will happen over and over and over again. Just because, you know, our clients, they want transparency. They want to, you know, feel like they're normal at some point. So being able to relate to us and then showing, you know, sometimes sharing similar stories of our own struggles is always helpful. But that we can achieve all those things, and I think we have been doing it pretty good job at it for the most part. It's not gonna be perfect. None of this is a perfect science, and so as long as we don't put these heavy expectations on ourselves or the clients, we can definitely move right through those.
Wonderful. I love it. I love the discussion. All right.
Yeah, sometimes they think that because we're there to provide for them, I think they think that we don't know. Some of us haven't been through what they've been through.
Exactly.
Yeah,
We,
we
yeah,
haven't experienced it. Yeah.
Yeah.
I have a lot of experiences from childhood all the way up.
Mhm.
And Angela kept telling me, you don't know what I'm going through. And I'm looking at her like, yeah, I do.
Even with having to take medications scheduled every single day, it's like a lot of the clients, they fight against the whole medication piece. But when you share with them, hey, I have to take my meds. If I want to live, I got to take these meds every single day. And when they hear you say that, it's like, oh, you take meds too? Yep, I take. Now, they don't know what kind of meds I'm taking, but just that commonality. So
I think it's great. Well, I want us to actually take a moment and do the third objective, which is valuing our customers' resilience. So I want us to kind of walk a mile in their shoes for a second. So I put inside your bag a egg.
Oh, we wasn't supposed to eat that?
You can eat chocolate.
I didn't eat it.
I did.
Eat the chocolates. So if you open up your egg, inside your egg should be, we're going to call it a yellow hammer, an actual boiled egg, and a glue stick, a glitter glue stick. Let me know when everybody has it out.
Okay.
Okay. We're talking.
Is this the hammer?
Yep, the yellow
and
hammer.
the glue stick.
And the glue stick. All right, so you have your boiled egg out?
Are you sure this is boiled?
I'm positive.
Okay.
So what I'd like you to do with your mini hammer is I want you to crack that egg. And I want you to crack it until some of the shell falls off. So go ahead and crack the egg.
Whoa. Mine's open.
Yours open totally?
Halfway.
Okay, just don't crack it. Wait. Okay, when you guys are done, let me know.
Okay, I'm done.
It smell like an egg.
Now, what I'd like you to do is open up your glitter glue. And I want you to take some of those shells and try to glue them back on.
With glitter glue?
Yep. Take the glitter glue.
Can I use some glue out my drawer?
No.
No.
Use the glitter glue. Try to glue the shells back on the eggs.
It's freaking dog.
Your dog gonna eat the egg, Mike?
The dog is just annoying.
How's that gluing going? Alexis, I can see you. Are you gluing?
I can't believe you put a boiled egg in all of our.
I can't either.
Mine is glued. Because I cracked it in the middle and then I squeezed like a whole bunch in the middle so it's not coming open.
Okay, perfect. Just hold on to your egg. Let me know when you guys have tried to glue some. Now you may not be able to glue all of them. Have you
It's popping open.
Can I see your
egg? It's cracked, but it ain't broke.
Can you show me your egg, Lynetta?
Okay.
It popped back open.
Oh man.
Wait a minute.
It's not working so good.
Okay, you
How
only
long
need a
has
little
the egg
bit.
been in here?
All right.
You see my egg?
I see your egg. Mike, let me see your egg.
Hang on.
He ate it.
What stupid dog. Just swallowed a Cadbury egg wrapper.
Next, Stephanie, let's see your egg. Oh, wait, let me see your Mike. Okay, Stephanie, let me see your egg.
You don't want to see my egg.
Yes, we do.
Come on, Stephanie.
Come on, Stephanie.
George, your egg.
Stephanie, show us your eggs.
Stephanie.
Oh my.
Stephanie.
She must have really cracked her egg.
Oh,
Stephanie, where's your egg?
oh,
Break her egg in half.
It's open.
It's open. Okay, Letitia, where's your egg? Did you not do it?
Oh, she showed it.
Let me see.
Where's Letitia's egg?
You gotta turn the chicken over.
Letitia, did you eat your egg?
We can't hear you.
Okay. So the significance of the egg, I didn't see Letitia's egg, but the significance of the egg is this. If we consider that the egg itself is our consumer, is our client, and the cracks in the egg is trauma. It's the traumas that they have in their life. And we consider the glue itself as the medication. And the glitter is what we try to do for them to help them take that medication and fixing them up and taking them grocery shopping. But what's the one thing that we all realize with this egg?
It's hard to put back together.
It's hard to put it back together.
Yeah.
It's really hard.
Yeah, that's challenging.
And it only like pitching and patching, you know. It looks like it's together, but it's not really together.
My egg has a lot of cracks.
And it's cracked. It's cracked.
It'll never be the way it
is that with trauma, when trauma is there, it's not something that's easily fixed. And when they're yelling at us, and when they're screaming at us, and they're cussing us out, and they're missing their days of medication, it's those cracks.
This is a very good analogy.
Now,
I'm going to use it.
But I'd love to share the deck with you. I'm just going to send you the email deck so that you can kind of go through it. The rest of what do you guys think?
That was good.
I think you should do it with the other team. But I do think that this is something like the egg analogy. I think if we look at our clients like that, it'll change how we respond to some of the behaviors that they throw off. You know, for people that have trauma, their language is usually behavior. Exactly. They're not able to tell you that I feel like this and I feel like that and this happened to me. They act it out. It's the behavior. Yeah. And so if all the teams know that this is kind of how their client is and we're trying to put these pieces back together, it changes your paradigm. So I think you should not end it with just our group. I think you should extend your presentation by adding the other groups, the other teams.
I'd be happy to. Anybody else have any thoughts?
I just really agree with Tony because I think that whole egg thing, it puts things in a whole different perspective.
I think to be good at this job too, just having more experience or knowledge about trauma is like super important too. So
I agree.
Some cracks don't go away.
Yeah. They just covered.
And that's true.
Yep, they just covered.
Yep.
Good job, Shalonda.
I really appreciate you guys. This is going to be a great presentation. Your feedback was great. Anything I could do differently?
No, it's good.
No.
I like it.
Thank you.
Okay.
This was good.
You guys have a good night.
You too.
Bye.